We're usually really very good at losing weight, but keeping it off has been our problem. I mean, how many times...
You will get your life back. If you have any recollection of being thin before the surgery and then had gotten heavy, now you have a chance to get your life back. And if you have no recollection of ever being thin and living a normal life and being able to fit in seats and not worrying about where you have to park and how far you have to walk, this is your time. This is your chance.
Your life does go back to normal, but not the normal that you used to know. You can still enjoy everything that you used to within reason, and moderation is definitely the key.
Now that your gastric bypass surgery is complete, it will be a challenge for you to meet your everyday nutritional needs. It won't be easy at first. Making wise decisions about what foods you eat in what amounts is absolutely vital to your full recovery from surgery. Making good food decisions will impact how you feel. Before surgery, your stomach could stretch to hold several cups of food and liquids. After surgery, it will hold only about 2 tablespoons. So your portion sizes will need to be greatly reduced. Here's an example. If before surgery you could eat about 1 cup of cereal, after surgery you will only be able to eat 1 tablespoon of cereal. You'll also need to supplement your diet with vitamins and minerals every day for the rest of your life. You'll need to take a multiple vitamin with iron, a B12 under your tongue, calcium, and other mineral supplements. Consult your guidebook for detailed guidelines. After surgery, many patients have increased sensitivity to certain foods, especially those high in fat, sugar, or refined carbohydrates. Eating these foods can cause unpleasant reactions. Immediately after surgery, eating too much or eating the wrong foods could cause a leak. Failure to get enough liquids can easily lead to dehydration. Failure to chew food to a consistency similar to applesauce can cause clogging. Eating foods high in fat or sugar can cause uncomfortable dumping. When this happens, you may have nausea, vomiting, become lightheaded or dizzy, have a hot flash, cramps, or diarrhea. These reactions are unpleasant, so you'll want to avoid foods that cause dumping. You'll be on a liquid diet for the first 3 weeks after surgery. Your guidebook contains a list of liquids you can safely choose from. It's a good idea to shop in advance. Cold or iced liquids and carbonated beverages can cause uncomfortable spasms. Caffeine needs to be restricted. Even liquids must be introduced slowly and in small amounts. You'll actually need to measure each swallow, which should be 1/2 ounce or 1/2 of a small medicine cup. You should drink 2 to 3 ounces of fluid every 30 minutes.
I guess I remember waking up and wanting the pain meds to ward off anything that might be worse, but it really wasn't that painful for me. It was, they talk about on a scale of 1 to 10, and I was probably never really more than a 3 or 4, but it was uncomfortable. But I think the most memorable part of that whole experience was they kind of said that after 3-4 days I would feel pretty normal. And I was in on a Tuesday, out on a Thursday, and by Sunday I felt like $1,000,000.
And I gave myself a good 3 weeks to really settle into this new lifestyle. I charted everything that I ate and drank, was very diligent to work out. I worked out for a half an hour every day on the treadmill, wanted to move and not just stay in a static position.
Your first day home, you should drink 42 ounces of fluid, or 5 1/4 cups. You'll need to be drinking small amounts continually throughout the day to reach this goal.
Well, the first sip that I took was with a nurse, actually, because I was a little nervous about what might happen, and I kept thinking, I'm going to take this, and what if something went wrong and it's going to expel into my body somewhere? And but I remember taking it and holding it in my mouth for the longest time, wondering if I could even swallow, and I did, and I felt it go down, and it felt relatively normal, except for it kind of sat there for a minute, and then it made a gurgling sound. And I thought that was really kind of odd, but eventually it went down, and after about a week or 2 or 3, things were getting back to normal, and it wasn't like that, and I could drink a little bit more at a time every single day.
On day 2 at home, your goal is 52 ounces, or 6.5 cups. By day 3, you should be up to 64 ounces, or 8 cups of fluid. These are the minimum goals. You may have more as you can tolerate it.
Whenever I was in that room, I had the water bottle right there, and it was a reminder to me, and then I didn't have to go very far to get water, and it made it a little easier for me to get the fluids in.
I actually measured in cups because I wasn't sure what it would equal out to, but it turns out it was 3 of these exactly that I needed to get in a day, and seeing 3 versus 80 just seemed more manageable to me. So I have 1 before noon, and I have 1 before dinner, and 1 before I go to bed, and I'm done.
Your guidebook has an extensive list of fluids for you to choose from and some sample menus. Drink what you tolerate best until your goal is met for the day to prevent dehydration. Remember, you'll need to slowly drink water and low-calorie fluids continuously throughout the day to meet your fluid goals. One helpful tip would be to divide your fluids throughout the day. For example, if your goal is 64 ounces, you should drink 24 ounces during the morning hours, 20 ounces in the afternoon, and 20 ounces in the evening. Milk, juices, and protein powder will help you meet your nutritional needs while on the liquid diet. But they must be added carefully to prevent dumping. Start with 1 to 2 ounces, gradually increasing to 1 cup a day for milk. You can flavor your milk with sugar-free Nestle Quick if desired. If milk causes you to dump, try lactose-free or soy milk. Dilute fruit juices to make them easier to tolerate. Protein powder may be added to almost any liquid. A protein like Beneprotein has very little taste and will not thicken your fluids. 1 small scoop provides 6 grams of valuable protein. 10 days after surgery, you'll be able to add tomato and V8 juices, along with strained and diluted low-fat cream soups. Check your guidebook for details.
For that first week, everything that we were allowed to have seemed so sweet that I was actually getting some heartburn. I was really getting kind of sick of all the sweet stuff. And the broth, I couldn't find a broth that I liked. I would drink some, but just to get me through. So when I was finally able to have the cream soups, it was just wonderful. It was something a little bit more substantial.
Your body needs a balanced amount of protein, fat, and carbohydrates, along with vitamins, minerals, and trace elements. It's vital that you eat as wide a variety of foods as possible to get the required nutrition. No one food can supply all the nutrients you need. You can add pureed food to your diet in week 4, but it must be the consistency of baby food to be well tolerated at this stage. Your blender will become an essential tool. Solid food that is not pureed may block your new stomach pouch or cause cramping and vomiting.
Okay, this feels like if I swallow it, it's not going to get stuck. What was stressed to me by Diane was your hole is going to be the size of a pencil eraser. You got to make sure whatever you eat is small enough.
Remember that your stomach outlet is now the size of a pencil eraser. Some examples of foods you may eat are sugar-free pudding, light yogurt, cooked cereals, and pureed meat, vegetables, and fruit. Be careful to choose low-fat yogurt and sugar-free puddings. Read labels carefully when you shop. Remember that you still need to keep portion sizes low, about 3 tablespoons total per meal. At first, you may be able to eat only 2 tablespoons of food, so eat the protein part of your meal first. Eat only until you are satisfied. Don't drink liquids with your meal or for 30 to 45 minutes after a meal. Your fluid goal continues to be 64 ounces or 8 cups a day, so you'll need to drink continually throughout the day. Eat slowly and take small bites. Take at least 20 to 30 minutes to eat 1 to 2 tablespoons of pureed food. Keep in mind how the pureed food feels in your mouth.
Don't cheat. Don't try those things that you can try just to see, can I eat a cookie? Probably, but it's not worth it. Drink your water instead, and you lose so much more weight.
On week 5, you can add regular food, such as eggs, fish, moist meats, beans, peanut butter, and fruit. Again, portion sizes will be about 1 tablespoon each. At this stage, you should be able to eat 3 tablespoons for your meals. Once you start eating regular food, you'll need to chew it to a pureed consistency before swallowing to avoid clogging. Chew each bite 20 to 30 times before swallowing. This will take some practice.
Before surgery, when I had gone through everything and I said it's really important that you chew a lot, I thought that was going to be the most things for me to struggle with. It's fairly easy for me to make sure that I chew enough to get it ground up and to that consistency that it needs to be. I've had 2 instances since surgery where I've not chewed something enough and it's gotten stuck, and both instances were times where I was not paying attention to what I was doing.
Sit upright while eating and drinking. Remember to eat the protein portion of your meal first. Your protein goal is 40 to 60 grams a day, which will be difficult to get from food in the first few months. 1 tablespoon of cottage cheese has 2 grams of protein, and 1/2 ounce of meat provides about 3 grams. Some people choose to add Bena-protein to your liquids daily to help you meet this goal. Your guidebook has sample menus you might find helpful.
Certainly the book was helpful. Eventually I did try to put in some different types of meat, but for the most part I had turkey and chicken and salmon, no sandwiches. I really wanted to be conscious of not going back to the lifestyle that allowed me to get to that point in the first place.
I do attend this support group. It's really helpful to go to those because people will say, well, I had tuna and crackers with cheese, and it makes you go, oh yeah, I can do that. Tuna and cheese, that's a lot of protein too.
By the 3rd month after surgery, you should eat only 1/4 cup of food per meal. At 6 months, you'll be able to eat about 1/2 cup per meal. After a year, your new normal meal size will be about 1 cup of food. You'll need to eat 3 meals per day for the rest of your life to meet your nutritional needs. And your fluid goal will remain at 64 ounces, or 8 cups per day. Remember, no drinking with your meals. Wait 30 to 40 minutes after your meal to drink. It's a good idea to continue to dilute fruit juices and to limit milk and fruit juice intake to no more than 8 ounces per day.
At least a gallon of water a day. All the weight loss is coming through that, and really to optimize that time, those first 6 to 9 months.
If I'm someplace where I don't have my timer with me, I make sure I look at my watch, and I shoot for 20 minutes for a meal.
Exercise is vital after weight loss surgery to strengthen your heart and bones and keep your metabolism up so your body burns fat and not muscle mass. You need to exercise every day after surgery. If you're not used to exercising, start slowly with 5 minutes a day. Keep increasing until you are up to about 30 to 45 minutes per day. Walking and swimming are recommended and generally well tolerated by most people. An exercise buddy can help keep you on track, and mall walking can keep you moving even when the wind chill is below 0. There are exercise videos for those who are out of shape or have knee or back problems. Keeping a food and exercise diary will help you meet both your nutritional and exercise needs. There's a sample food and exercise diary included in your booklet. Copy this page and use it as your guide to a new and active life. Changing old habits and developing new, more healthful ones takes time, but it's worth the effort.
So yeah, I still enjoy food. I have to work every day to follow the rules and make sure I get in my fluids and eat protein first. It's up to me what I do with it, and my tool will be as successful as I want it to be and as successful as I make it.